supine thenar mastoid lift, occiput left lateral flexion restriction. So the first thing that I'm going to do is I'm going to put the heel of my right hand in my forearm to stabilize the head, and then I'll be stabilizing on the parietotemporal area, cupping the patient's ear with my fingers going down the spine. Then I'm going to go ahead and take my left thenar and place it on the left inferior occiput. I'm going to rotate the head away from the contact, apply a long axis distraction, and my line of correction is lateral to medial I to S. Supine index pillar push, C4 left rotation restriction. So first, I'm going to take the palm and fingers of my left hand to stabilize the head on the inferior tip of the left mastoid and cheek. And then my contact point is going to be on the lateral aspect of my index finger on my right hand. I'm going to find my contact over the right posterior articular pillar of C4. And then my tissue pull is P to A, medial to lateral, with my line of correction being straight P to A through the facet plane. Cross bilateral T6 left rotation restriction. So the first thing that I'm going to do is get my contact point, put my left hypothenar on the right TVP of the superior vertebra, and then my stabilizing hand will be my right hypothenar, and I'll be putting that on the left TVP of the inferior vertebra just below my contact point. My tissue pull is P to A, medial to lateral, line of correction, P to A, I to S along the facet plane. Side of table, pisiform TVP push, T1, right rotation restriction. So I'm going to get my contact, which is my pisiform in my right hand. I'm going to place it on the left TVP, and then my stabilizing hand will be on my left thenar on the left mastoid, cupping the ear, providing I to S traction. I'm going to have my patient look towards the contact first, and then I'll take that tissue pull. And my line of correction is P to A, I to S along the facet plane, leaning forward to accommodate for kyphosis. Prone bilateral index pillar push, C4 posterior. So for posterior, both my hands are actually the contact hand. So the contact point are the lateral aspects of my index fingers on the right and left hand. And then I don't have a stabilization point since they're both doing the same thing. My tissue pull is P to A, medial to lateral in both hands. And my line of correction is straight P to A in the facet plane, which would be straight down for C4.